Hi, my dog lovers. Hi. I'm really excited today. I have an amazing guest here. She lives in Vancouver, and her name is Dr. Radica Raj. And Dr. Radica is quite special because she has experience in emergency medicine. And as she worked in emergency medicine, she realized that integrative and holistic practice is actually what her heart tells her to do. So she switched, and she is one of those people who has an experience in both worlds, similar to me, but even more so because she worked on the emergency level and she understands the powers of conventional medicine when it comes to emergencies, but she also understands how much we need integrative and holistic approach to healing. I think that so many dog lovers need to meet you, need to understand that there are many colleagues and veterinarians who actually have gone through the route of conventional medicine and just kind of adjusted to what their heart was telling them. And I would like you to tell me the story, how you became a vet and what made you be a vet and a healer.
I became a vet because I love James Herriot and his books. I couldn't understand how he ate his patients, though. He did eat like his beef, but that's okay. You know, he was truly compassionate and he loved his patients. Like all little girls, my parents thought that I changed my mind when I grew up, but no, I seemed to hold on. And went through, like everybody else, went through school and got into practicing conventional medicine. But I must say that I got pretty tired of conventional medicine. Not that I don't believe in it. I think it's great for emergencies, but I felt something was missing, and that I had to make that jump to start practicing holistic medicine, encompassing everything.
What do you think is missing in conventional medicine?
Conventional medicine is awesome for emergencies. Just love it. I love being able to fix most things like that, and that sense of accomplishment that you have after like a 22-hour shift is amazing. However, there's nothing for chronic conditions. That's what conventional medicine lacks. There's nothing that doesn't cause more suffering, more pathology, more side effects. And I wish there was, but that's where we have to turn to holistic medicine, and there are some answers there.
You said that you worked in an emergency clinic. I worked in conventional and also holistic clinics. I know that it's sometimes really crazy to kind of deal with the daily. It's really hectic and it can be quite ungrounding. What do you do to actually ground yourself and just kind of go through the day with...
I was a different person when I did conventional medicine. I would be, 3 nights on and 2 nights off, and then I'd do 2-day shifts and stuff like that. It's different now. I try to be grounded because, 1-hour consults with clients who are been through a lot of frustration. They've gone to so many different they've tried so many other things to try and heal this condition, and they're pretty frustrated by the time they come, and I totally understand that. So that's when I know that I need grounding. So try to do yoga every day, meditation, of course, and make sure I'm in that space when I enter the room. And I can tell the difference. The days that I'm not grounded, I can tell the difference, how the appointment goes. It's all great, but I know that I've either taken on the pain and frustration of the client or my patient. You can always feel it. And I'm sure you've been through all that and you know exactly what I'm saying.
Before we started recording, we were talking about how similar animals and their people are, and how when we are in the exam room, how it's a real triangle because we kind of affect our patients and clients and they affect us, and it's an energetic kind of connection. Do you see it often that animals suffer from conditions that their people have, or vice versa?
Very often, yeah.
How often?
I would say 90% of the time. And you know how it is, usually the dog comes, has a skin disease or has diabetes or something, and then the owner says, at the end of the appointment, actually, I do have a problem with my skin too, or I do have type 1 diabetes too, stuff like that. It just happens so often.
Do you have any explanation to it?
Animals do take on what the owners have. They take on a lot of our stuff. Whether we realize it, whether we accept it or not, they do. And it's not a bad thing necessarily. I think they choose to do it.
Yeah. I've always been interested in the energetics of healing and just
Me
kind of
too.
assuming that we are nothing else than an electromagnetic particle combination that kind of ends up being us or our dogs or whatever. So I always see disease as a disharmony in the particle arrangement. It's kind of like a silly way of seeing it, but treating disease is basically rebalancing the particles, resetting the harmony. It's almost like you reset the computer.
Exactly. Yeah.
So I think that if we are animals are energetic beings, then of course the energies of each other affect the other side, right?
And that's why I'm trying to see where to go from here. Right now, I'm happy doing what I'm doing. Treating using acupuncture, chiropractic, Chinese medicine, regenerative medicine. But I think the future of medicine is purely healing, and healing without physical substances, healing on a completely different level.
Star Trek medicine.
Star Trek medicine, you got it. Yeah.
But until then, we still have to use what we have and what we know. So tell me, what do you use? What kind of disciplines do you use in your practice?
Yeah, I started with acupuncture and Chinese medicine. As soon as I stopped, I owned an emergency clinic. I got out of it and took a year off, and in that 1 year, I got certified in acupuncture and Chinese medicine. Then a year after that, I got certified in chiropractic, and then I just accidentally got into regenerative medicine. I mostly use platelet-rich plasma over stem cells because stem cells are still very cost prohibitive, and I don't think medicine should be cost prohibitive for a patient.
Yeah.
And I also got certified in rehab. It's amazing how rehab is basically physiotherapy, so it's amazing how much rehab can do to heal tissues and bones and joints and everything, and restore normal mobility. And I love platelet-rich plasma because I feel it's one step ahead where I'm talking about healing at a different level, because the platelets were originally considered to be just responsible for blood clotting, but platelets, you take it from the same patient, so it's called autologous. So if you inject the autologous platelet-rich plasma back into the same patient, the platelets break open and they release like 300 to 600 growth factors. And these growth factors are actually what causes tissue repair and regeneration. It's like when we have a cut and it bleeds, right? We think that, and then the bleeding stops. We think the bleeding is just, it's bleeding, and then the platelets cause the blood clot. The platelets are not there just to stop the bleeding. The platelets are there, actually, they break open and they release all the growth factors, and that's how your cut heals.
Oh, wow. Beautiful.
It's so amazing.
Nature, right? So basically everything that we should do in healing should be aligned with nature and kind of respecting the principle of natural healing. Now, going back to the platelet-rich plasma, what would you recommend using it for?
I use it for partial cruciate tears. And sometimes I find they still have to go for surgery because during the healing period they anyway manage to tear their ligaments fully with super overactive dogs. But where they can't go in for surgery based on age and whatever other ailments they have that prevent them from going under anesthetic, I use the platelet-rich plasma for partial cruciate tears. I use it to manage osteoarthritis. It's amazing how much of pain relief it provides to senior patients. It's just awesome. And my major success has been back pain, those intervertebral disc disease, those dogs that are screaming in pain, and people can't afford a CT or MRI and surgery. Those are the ones, the wiener dogs especially. And I'm saying I got into it quite accidentally. It's quite amazing how
did
I got
it happen?
into it. I went to meet this guy in Seattle. He's an older gentleman, a veterinarian, and he said he does prolotherapy. He says he injects the sugar solutions into the joints. I do that as well. I came back to my clinic. I met with him. He didn't even show me on a live patient. He just said, this is what I do, showed me a syringe and which parts, pointed at where to inject it for the knees and elbows and all that. So I came back and I had a wiener dog called Slinky, one of my patients. And the owner came in, the dog was screaming in pain. I tried a couple of acupuncture sessions, laser, nothing worked, the dog was screaming. She said surgery is not an option, she can't afford it. So she said, you have nothing to lose, but you can do something. I know you can do something. So I'm like, okay, let me try this. So I injected the prolotherapy solution in acupuncture points along the spine. And they videoed the dog every day 1, and by day 3 the dog was running and jumping. I broke down and cried when I saw how happy the dog was, because he was only 6 years old, right? Otherwise she would have put him down. So that's why I'm saying I got into it accidentally, because when I contacted that vet in Seattle and I said I did this, he said, I didn't ask you to go inject the spine. And after that, there's been no looking back. I have a 98% success rate for intervertebral disc disease.
So you use platelet-rich plasma mainly for mobility issues, inflammation of joints, and back pain, back discomforts, cruciate ligaments, elbow dysplasia. Anything else that you've used it for?
Yes, I use it for certain skin cases, dermatology cases. I treated a cat that I suspect had what's called the lupus erythematosus. He had
Autoimmune condition.
Yeah, ulcerated, more like an ulcerative dermatosis. His skin biopsy didn't confirm anything. It was inconclusive. The cat had been suffering for almost 5 years. Even steroids couldn't keep him down. He would have huge flare-ups, almost like flesh-eating disease, where his skin would just ulcerate everywhere on his face and body and inside his ears and all that. It was quite horrendous.
Yeah.
So I injected platelet-rich plasma into his acupuncture points. I did 1 treatment and did laser once a week for 5 weeks. Completely, skin grew back, everything healed. It's been 5 years now, he hasn't had a relapse. And I presented this paper last year in Florida at the World Association of Traditional Chinese Veterinary Medicine Conference. And I'm going to Shanghai in November to present a paper on use of platelet-rich plasma in intervertebral disc disease.
Wow. What do you think the most obstructive force in medicine is when it comes to development of medicine and evolution of medicine?
So I would say regulations, regulatory bodies, the government, I wish they would make it easier for people to be able to access both conventional and holistic aids. It's getting harder to source herbs. Some of the companies are not able to provide me the Chinese herbs that help my kidney patients cure incontinence. Incontinence, Chinese herbs, amazing. The dogs are no longer incontinent and they stay dry. And after a while, I can get them off it. Herbal formulas completely stop seizures. Again, 90% success rate. There's 10% that don't respond, and we don't know why. So it's getting harder to source my herbs.
Why do you think research is so one-sided and doesn't really go into holistic as much or natural treatments?
I think part of the problem is also people like me. I'm so busy. I don't have enough time to write my research papers. I don't have enough time to send my papers in and follow up on it. So I think if we did more of that, I think that would help as well. I think universities should start promoting it. I think universities should start offering all these courses in school, so that then they will have the database. The students can take the time to do research, to already publish and present cases, and that will really help with the university.
You know what I really love about our conversation here? That when I'm looking at you, I know that you are speaking from your heart. Like there is no mask, there is nothing, there is no pretense. And in medicine, quite often at school, we've been taught that if we don't know, we fail. So I think that we veterinarians have been conditioned to quite often pretend that we know. And I've always had a problem with some of our colleagues having a hard time to say, I don't know. And when I was in my practice, I caught myself often not knowing, and I would actually tell people, I have to research that, or, I don't really know, but I know someone who may. How do you deal with not knowing?
I I think it's okay to not know. Don't I mean you know and I know that it's okay to not know. But exactly the same way I have the same situations where I just go like, oh my God, like I don't know. But I'll try to find out, or I'll refer you to someone who knows, And that's one of the things I offer homeopathy, but I'm not a classically trained homeopath. I don't know if it's a previous lifetime memory, if you believe in that, but it's like sometimes I'm looking at a dog and it's like, it literally, this remedy keeps jumping at me, use me. So that's how I practice homeopathy. So, but people come to me and say, oh, we want homeopathic remedies for this condition, and I can't do that. So I always refer them to somebody else who's a classically trained homeopath and who's also a veterinarian, right? So can't know everything.
I practice homeopathy for since about 96 or 97, actually. Dr. Karen Becker was in my class. We were there together.
Did you learn from Dr. Pitcairn?
Yeah, so I started with Dr. Pitcairn, and then I thought, I wanted to learn something new. And I started taking courses of human homeopathy and started applying them to animal homeopathy. So I studied with homeopaths that were using the periodic table of elements to actually derive remedies, and it was really effective. I published only one study, and that was a study on cats.
I've read that, hypothyroidism in cats. I saw your name on it.
Yeah, but the bizarre thing is that I actually lived with our cat. She was 21 when she passed away. She was diagnosed hyperthyroid when she was 7. No drugs, no radiation treatment, and she was medication-free until 21. So, you can't really, once I started seeing one, and then I repeated the treatment again and again, I couldn't not use it.
That's quite the story, because I have a similar story. I inherited a 20-year-old cat in my practice in Courtney. The owners came, brought her for euthanasia. I picked her up. I knew she wasn't ready. You know how we know she wasn't ready? She was a bag of bones and pretty scraggly looking. So, but I said, I'll keep her. And they said, okay. And they dropped her off with me. She was 20 that day. And she lived for 4 years. I did a blood work on her right away. I found she was emaciated, long-haired cat, looked nasty. She was hypothyroid and had mild kidney dysfunction. I put her on a raw diet. I mixed a little bit of the YD in it. I hate to say it, Hill's YD, but I did because I know there's something in that helps the hypothyroid cats. No medication, no radioiodine treatment, nothing. She just blossomed within a couple of months, gained weight, and I have before and after pictures on my Facebook page too. She lived until she was 24, and she didn't want to go. I finally put her down because she stopped eating and she couldn't swallow. She lived for 4 years, and her owners came to see her and they could not believe it. Just before she died, about 6 months before she died, they came and they said, we don't know she's still alive, but we dropped off a 20-year-old cat 3 years ago. And I brought her and showed them. And the same thing like you, hypothyroid. And on this cat, I did no homeopathy. Oh, I did Chinese herbs. I would just sprinkle it in her raw diet and she would eat it.
She would eat it.
Yeah.
Animals kind of intuitively know what they need.
I think so.
Level, right?
Yeah, they do. Yeah.
What do you think of the controversy between kibble and raw food and cooked food? What is your approach to feeding your patients? And what do you recommend?
I hate to say this, I'm a vegan. I've been vegan for 26 years, but I'm not 100% convinced that dogs and cats can be vegan. In certain cases, yes, a vegan diet can help to resolve certain illnesses, even cancer. But I tell most people to feed raw. Whenever anybody comes in for a consult with me, I recommend raw. Next to raw is cooked or freeze-dried. That's the next best. I haven't seen anything good come out of kibble, to be honest. And with all the reading that I've done, it's pretty scary what goes into it. And I think if we are looking at preventative wellness, which is what it should be, I don't want to see my patients come to me over and over again. If a puppy comes into my practice, I want to see very little of that puppy. I want this to be a happy puppy that doesn't need to go to the vet. So start on a raw diet is what I'm
So your goal is to put yourself out of practice.
I think I think my goal is preventative wellness and healing. When they're older, they always need help. They need healing. But when they're young, they should just be happy. And that's the reason I also do titer testing. I don't over vaccinate. It's a healthy balance between protecting your puppy but not over vaccinating. And there are only core diseases that we should be vaccinating against, I think.
Vaccines were the next question I was going to ask, and you already started. So how do you approach vaccination and immunity in dogs?
Yeah, I basically questioned myself about the different vaccines. I researched, read about it, not just from textbooks, but, everywhere. I found out what to me felt to be the core vaccines, having worked emergency as well. And I kind of knew that parvo is the core vaccine. And then having traveled to the States so much, we actually see distemper. I realized that distemper is also a core vaccine. So I picked those two vaccines, and of course rabies is very controversial, but when it's needed, it's needed.
Yeah, in areas where there is rabies.
Exactly.
And it's hard to take a chance, right?
Exactly.
You make a recommendation, do not vaccinate against rabies, and then you put the lives of the animals at risk. I agree 100%. So distemper, parvo, and rabies in the areas where there is rabies.
And where it's endemic, And I'm basically, I developed my own vaccination protocol, what age to vaccinate, when is the first vaccine, how many to give, when do I do titer testing. And strangely enough, then I went back and looked at all the publications from Dr. Ron Schultz and Dr. Jean Dodds, and I realized Dr. Jean Dodds' protocol matched mine almost.
Nice. So you do titer testing. When do you do the first titer test?
It varies depending on how many vaccines they've had from the breeder. Some dogs are now having vaccines at 6 to 7 weeks of age, which I think is a little too early. They even spayed and neutered at 6 weeks of age. So it all depends on what they come to me with, how many vaccines they've had. So I also split my vaccines. I give parvo separately, and 3 weeks later I give distemper.
Nice.
Right now in Canada, we don't get the distemper vaccine by itself. If anybody out there knows how I can get the distemper vaccine, you need to let me know. But it comes with adenovirus and parainfluenza, but it's still better than doing a 5-in-1 and 7-in-1. So that's what I do, split the vaccines 3 weeks apart, and then I titer test. And if the antibodies are adequate, then I just repeat the titer test.
It's really cool to hear what you do with vaccines, because I also believe that vaccines should not be given altogether in combination vaccines because it's too much stress on the immune system. I have been going with the knowledge and understanding that the immune system of puppies is actually mature and can respond to the vaccine. And if we inject a vaccine into a puppy that is protected by maternal antibodies, that those antibodies basically get neutralized by the vaccine, right? They interact with each other and they get neutralized. So I really love the idea that nature knows the best and that the immunity is there. And while the immune system is maturing, the puppies start producing their own antibodies. So I usually check the titer at the age of 12 weeks, just kind of make it simple. And then if there are antibodies against parvo distemper, then I don't vaccinate and I just wait until maybe five months of the age, repeat it again. And if the antibodies are there, I actually go again for 6 more months or 7 more months until the puppy is 1 year. And then when the antibodies are still there, then I go, okay, we'll just remeasure it in a year and then go from there. Have you ever had any cases of infectious disease with this vaccination protocol that it would actually fail?
No, I haven't.
Yeah, very cool. I haven't either.
Yeah.
So it means it's working?
I think it's working. I think especially because we are in a low risk area. Although, I had my emergency clinic in Ontario, Richmond Hill, Ontario. I saw a lot of parvo cases. But again, those parvo cases were mostly puppy mill puppies or pet store puppies.
Stressed, malnourished, not fed well.
Yeah,
and all
immune
that.
deficient, yeah.
Tell me about dogs. What do you think is the best part on living with a dog or with dogs?
I've had dogs all my life, except in the past few years. Somehow, since actually in the past 10 years, since 2009, I've ended up with cats. And I don't know how that happened. My husband Robert is a cat person. He's constantly having long conversations with him, and they reply. And I want a dog. I haven't had a dog in a long time because it's so special living with a dog. It's. I'm not saying that it's not special living with a cat. I love my cats, but I miss having a dog as well.
So what is the biggest difference between cats and dogs in your experience?
I think it's cats don't care. Cats cats are not there to please you. They want you there to serve them. And and that's why I want to have a cat and a dog, because the dog's going to wait on me and hang on to my every word and wag his tail. But I'm going to be waiting on the cat, so it's a good relationship.
So basically the difference is having a best friend or being a butler to cats.
I like that.
I lived with two cats, and gradually I kind of transitioned to being a real dog person. Just, we grew up with a dog. We had a dachshund. Her name was Gerda. 4 kids, and she was the 5th one. And she was the favorite child of my dad, who was also a vet. But then I was dogless until I came to Canada and we adopted a cat, a stray cat from the veterinary clinic, as it always happens. And then I was given another cat who didn't really get along with the first one. So I had lived for about, 10 or 15 years in a cat drama. And then I got Sky in 2001. And it was like the best part of my life. I always said that the best part of my life started with my dog, because he was just so amazing. It's like really having another fully fledged being, a soul that is just so aware. And I had so much to learn from him, right? He also taught me so many different approaches on, some of the healing methods and treatments. Like when he was a puppy, he had diarrhea because I over-exercised him, and he started having spasm or muscle tightness in the lumbar area, which relates to the digestive tract, right? And he started having diarrhea, and so I started looking around, started researching meridians and how it all relates, and realized that diarrhea and lumbar pain and discomfort is very connected.
Absolutely, yeah.
Are there any interesting connections that you would like to share with the dog lovers online?
Yes. I had a patient, a dog who was quite bloated, and this was just after I got out of emergency, and I had just done the acupuncture course, and oh my God, the connection between digestion and the lumbar spine. The acupuncture points are right there. There's a bladder, 18, 19, 20, 21, stomach, spleen, liver, gallbladder. I just put the acupuncture needles there, and I could literally hear everything start to move. I could hear the gurgling of the intestine, everything. The dog went out, passed a lot of gas, had a bowel movement, and was fine. And I just went, oh my God, as an emergency vet, I would have done x-rays first, and then I would have said, oh my God, he's bloated now, and his stomach's going to twist anytime, he's going to have a GDV, we need to do this, we need to do that. I would have put him on IV, I would have started antacids, and if he hadn't progressed, I would have tried to chokerize him. I'd have done all kinds of things. And here, the answer was so simple.
Just a few needles.
Just a few needles, and it worked. And it's the same thing with paralyzed dogs. I do acupuncture, and sometimes at the end of my first acupuncture session, a dog that was carried in stands up. And I just go, I still can't believe it after all these years where paralyzed patients start walking after 3 or 4 sessions of acupuncture. I just love it.
What I find interesting that in the course of being a vet, I've met many people who went from conventional to holistic or integrative medicine. I don't really know many people who would dismiss integrative medicine after they have experience with it. And I know so many conventional colleagues who are still suggesting that the only standard is conventional medicine and drugs and surgery, and that we should not be diving into the integrative medicine or holistic approaches. Why do you think is that there's such a discrepancy?
This is actually a little hard for me to go back to because that was me. I was a naysayer. I was one of those that believed in conventional medicine. When I had my emergency clinic late at night, if I had a seizuring dog and the dog would not stop seizuring, and I wanted to do something more than Valium or start a CRI of Valium, and the owners wouldn't give me permission because they'd say, "Oh, my dog's on herbs or homeopathics, and I want to take my dog home and start back on that." I would be so angry because I didn't know any better. So I actually have a lot of compassion for my professional colleagues now that are that way. I just hope they change, they find out more, because I made it a point to find out more, because I knew there was something beyond conventional medicine that would help as well. I made it a point to find out. Some of us may never change, and some of us may change, but I think this is where it's heading. This is where medicine is heading. So you know what? Pretty soon, people have to jump on that wagon, and roll with it. So,
what is your biggest dream when it comes to your work or your, what do you hope for in medicine?
I want to see wellness centers in the future. I don't want to see clinics, just multiple clinics all practicing the same conventional medicine. Instead, they should start having wellness centers where you have acupuncture, chiropractic, massage, like they had for humans now. There's so many wellness centers. Mm-hmm. So it should be a one-stop shop for people. You have emergency, go to this room. You want general practice, conventional medicine, go to this room. You want alternative treatment options, go to this room. It should just, I literally envision that. I know I don't want to run it. If I was like in my early 20s, I'd want to start something like that. But I still want to be able to pass on, whatever I've learned in the past few years to people that want to learn and practice, vets that want to learn. I would love to encourage any new graduate to come talk to you or me or to people like us and learn, because they have their whole life ahead of them, and start working on these things.
I hope we'll get together again. This was so much fun.
Oh yeah, we have to.
Let's try to see what our listeners also want, and if you have any questions about some of the topics that you mentioned, anti-inflammatory treatments, arthritis, disc disease, how you deal with herbs and acupuncture. Like, there's so many questions. I'm sure that there will be some. Get ready. Yeah. And thank you for coming. I so appreciate it.
Thank you. Okay. So I'm so glad I came. It's so nice to meet you.
Namaste.
Namaste.